Welcome to Ararat Healthcare and Charcos Learning Centre, your one-stop solution for IELTS, OET, CBT and OSCE training, as well as recruitment to achieve your dream to be a registered nurse in the UK. To enhance your chances of passing your OSCE on the first attempt, please visit our website on www.charcoslearningcentre.com to register and book our unique OSCE portal consisting of videos, reading material and quizzes. This registration not only gives you access to the portal, you will also receive 5 complimentary online classroom-style sessions and a mock OSCE test. So don't delay, you're achieving your dreams any longer and sign up now.
Hi everyone, my name is Dr. Seema Balian. I'm the Director of Ararat Healthcare and Charcos Learning Centre. Welcome to my lecture series on NMC OSCE. Now in this series, I will be covering up the topics related to assessment, planning, implementation, evaluation, some of the new scenarios which have been added such as the NG tube, pressure ulcer assessment, and VIP and the intravenous flush, and also we are going to take you through the fluid balance. The aim of this series is to understand in depth that the logic behind all of the things, why we are doing, how are we doing these things, what precautions we have to take while we are doing assessment and the rest of the stations, and also the top tips. So I hope that you are going to gain out of it as much as I'm trying to put in my efforts. There are 7 episodes to this series which are going to be covering up various topics. Please do let me know if there is anything that you would like us to discuss about in future as well. And it would be great if you can subscribe on our channel and press the bell icon to get the regular updates. So I hope you will enjoy it, and thank you very much again for watching this series.
Care planning is the second station after assessment comes the care planning. Now, I'm sure that all of you, while you were studying and in your career so far, you would have done care planning. So it is not anything that I'm going to tell you anything new. But that is also, I'm sure that no one would have done the care planning under timed pressure. Yeah, and also to choose 2 problems and write in a certain way. So that is something that is new, and that is what I'm going to tell you, that how you can manage, or what should be your thought process when you are thinking about care planning, and how you can make it easy job for yourself. Now, basically, when we are doing the care planning, see, when we go to do the assessment, our assessment itself should tell us very clearly that what are going to be my 2 problems which I'm going to write in my care plan. Yeah. In fact, even before the assessment, when you just read the history, in the history itself, you should have a fair idea that, okay, I'm going to be choosing these 2 as a problem, unless the patient is telling something which is drastically opposite than what it is written, and then I will modify my care plan. Because if you get a history that, okay, this is a patient who has been discharged from the hospital, like say, for example, Henry, if I take, Henry's history would be something like that, that Henry has been, he's a known diabetic patient who recently suffered with diabetic ketoacidosis and was admitted to the hospital. He is now feeling a bit better and has been discharged to the care home or the nursing home. But he also have not been eating very well and has been suffering with malnourishment. So we want you to do an assessment, a community assessment for this person, and also assess for the must screening and discuss your finding. So this is kind of a scenario that you will get. So when you get this scenario, immediately I think that, okay, he has not been eating very well. So probably his malnourishment is going to be one of the main problem. He is known diabetic and he had a DKA recently. So I don't know that whether he's managing his diabetes very well. If he has had once, it is possible that he can have again. So probably diabetes or his risk of further deterioration of diabetes is also a problem. Since eating is a problem, it is possible he might be suffering with constipation. So constipation can also be a problem. It is also possible that maybe he's recently got back from the hospital. So he might be feeling very anxious about his conditions and thing, that he might be worried that whether he will be able to maintain his blood sugars or not. So anxiety might be one of the problems. So just by that much history, there are so many things that you can think of that, okay, these can be the problems that you can choose. Now, then you go in to do your assessment. So if you feel that these are the 4 probable things that you have got in your mind, you can try and elicit those things. So malnourishment is outrightly, it is coming as that, okay, patient is having a score of 1, so he is malnourished. So that you know that, okay, this has been established. But you can also check with the patient that about the constipation. Patient has already said that, okay, yes, I do suffer with constipation as well. So there you go, you have got your 2 problems, which you have elicited as well. But also you could ask that, I know that you were recently over there. Are you anxious or are you worried about this thing? And the patient might say that, oh, yeah, I'm a little bit worried or I'm a bit anxious. What is going to happen? So you can have anxiety as your problem. So if you already have something in your mind, then what you can do is that you can ask questions in such a way that you can elicit that problem. And then you can take that as your problem in your care plan. Did you understand that? Yeah, does it make sense?
Okay.
Okay. So now if we go through the my presentation, now do all of you understand what is a care plan? Can anyone tell me that what do you understand by care plan? Titi, do you want to tell me? What do you understand by care plan?
For this, we have to give care for the patient according to their problems. So for that, we need to take to prioritize the cases, which is the most priorities. So we have to select 2, and according to that, we need to give care.
So, but what exactly is a care plan? And why do you write the care plan?
Yeah, so we are planning for care for the patient. So we need to write that. According to that, for the next step also, we need to provide the care. So for that, we are just writing the care plan.
So if I say that basically care plan is something that you formulate some steps in order for you to look after the patient better and also according to his problems. So that becomes like your care plan, that what are the steps that you are going to be taking in order to look into the patient's problem and to help him to get better. Yeah. Will that be what a care plan is? That, okay, this is what my plan of the care which I will be giving to that patient while the patient is over there. Yeah? Also, I think the next question would say that why do we write a care plan? Now, basically, we write the care plan so that it is clear in my head. And as you will agree that you are not the only one who is looking after the patient. Yeah. It is after 6 hours or 8 hours of your duty, there is someone else who is going to come and take it over from you, isn't it? Because you work in the shifts, so it is going to be someone else's shift. So if you have written a care plan, then it is going to be helpful for that other person who is going to be coming to go through your care plan and give a continuity of care. That, okay, they can see that what the care plan is written and can give the care according to the same plan. Have you understood that? Yeah.
Yes.
So this is an important point, because when you are going to write any care plan, whether it is for the exam or whether in your real life as well, you will always should think this thing, that someone else is going to read this care plan, and after they read this care plan, will they get a clear idea of what they have to do? So that should be the reason that why your care plan should be well thought, and it should be very simple and clear. That like you, if you go and start reading someone else's care plan, you would want that there is a certain information which is there, which will make it very clear for you to understand what has been happening with this patient and what you have to do. Yeah. So whenever we are writing a care plan, think about this thing. And that is the reason that why we write the care plan. Now, the next few questions which are there, that what is the format, various section of the care plan, that we will come. And what information do I need to write in the care plan, how I will be evaluated, and all these are the questions which we are going to answer in as we go along. Yeah, so again, going through it, that what is a care plan and what is its purpose. So care plan basically is a document that provide a direction for the individualized patient care. The main focus of a nursing care plan is to facilitate standardized, evidence-based and holistic care. So it is, the standardizing is a very important word, that you are making it a standard, that how this is the way that it is to be written. This is a way that the patient is going to be cared for. And it also, the purpose is continuity of care, as we had discussed. It is also used to record the patient's problem and identify the desired goals. It also states the intervention that must be undertaken to achieve the goal. And it is important that the whole nursing team should be able to follow the care plan. Do you agree with all these things?
Yes.
Yeah? Okay, great. So then we come to the format of the care plan. Now, in the format of the care plan, so if I go to the next slide, I think that you will be able to understand better. So that is what that you see, that current format of the care plan for the exam purpose. This is how a care plan format will look like. Now, in this one, it is usually one A4 sheet that you will get. On both the sides, it is going to be the same sort of thing which is there. So one care plan, you will have to write for the exam, one care plan with 2 problems. So care plan is going to be 1, but there are going to be 2 problems. So there is nursing problem 1 and nursing problem 2 that you will need to write. Okay. So, and you will be given 15 minutes to write this. So it is very important that one of the problems that everyone has is that 15 minutes is too less for us to write it. But by the time they reach the exam, everyone comes back saying that, oh, they had 2-3 minutes left. Still they completed it. So it is not 15 minutes. With practice, you will be able to write. Yeah, it should be focused. We don't want you to write a lot, but whatever you are going to write, that should account for. That should be something which is important. Okay. Now, the first thing that you see in this one, after the patient's name, date of birth, and hospital number, the very first thing that you see is the nursing problem. That what is the nursing problem? Yeah. So when you are trying to find out that what is a nursing problem, I think that always you should think about that, okay, what is the problem? And usually the presenting problem or the problem that the patient came with in the hospital should be your first problem. Yeah, because that obviously is the main problem of the person. For example, if someone comes with breathlessness or shortness of breath, and later on has been diagnosed with asthma, then that should become your first problem. That, okay, first problem is shortness of breath. Maybe your second problem could be that patient also told that he also has pain in his chest. So chest pain can become your second problem. Yeah. Or anxiety, he told later on, he told that he was very anxious as well. So anxiety can become your second problem. But the first problem should always be the problem that the patient was admitted for or patient presented with. Okay. Now, when you think about the problem, you then need to think about this thing, that why do I think it is a problem? So first question that you have to answer yourself is, what is the problem? And second question is that you have to ask yourself that why is that a problem? What evidence do I have which tells me that that is a problem? Now for shortness of breath, what can be that evidence that you can use? Angel, can you tell me that what evidence can you use for shortness of breath?
Hello, ma'am.
Yes.
Hello.
Yes, Angel, go
okay,
ahead.
ma'am. Yeah, I can use the objective data by taking the respiratory rate.
Absolutely. So you know that patient is short of breath because his respiratory rate is higher. His normal is around 20, but his respiratory rate is at the moment is 22, 24. Yeah. So how you are going to write that is that the main problem is the patient is having shortness of breath as evidenced by the respiratory rate of 24. Yeah. Same way, if pain is the problem, then what can you use to say, what evidence can you use to say that, okay, why pain is a problem? How do you know that pain is a problem?
Pain score can be given for the patient.
Pain score. So absolutely. So you can say that my patient is suffering with pain as evidenced by the pain score of 4 out of 10. Yeah. So this is how you are going to be thinking whenever you are writing a problem or whenever you are choosing a problem. These are the two questions that you need to answer. That what is the problem and what evidence do you have to say that that is a problem? Okay. Now evidence can be either it can be a concrete objective evidence or it can be a subjective evidence. Say for example, you are saying that patient is suffering with anxiety. What evidence are you going to give for that one? Why do you think? What can tell you that patient is suffering with anxiety? Anju, do you want to tell?
Ma'am, by seeing their face, they may become anxious, and also if they're asking many questions, okay, we can identify the patient is anxious.
Well done. So it is not always that we are going to have a very objective criteria. We have to use the subjective criteria as well. So you are going to say patient is anxious as evidenced by the facial expression and also by verbalizing. So it is possible that patient directly say that, okay, I'm very anxious. Yeah. Or it is that patient's facial expressions are that you look at the patient and you know that they are very anxious. Okay. So the problem is that is how we are going to figure out the problem. Why, what is the problem and what evidence do you have to say that that is a problem? Yeah. As long as you remember these two questions, you should be able to sort out any problem that you are coming across. Yeah. Just answer these two questions. Okay. Now then after that we come to aim of the care. That your next thing. Now, if you have got the problem, your aim is always going to be that you have to resolve the problem. Yeah. So if the problem was that patient is having shortness of breath, your aim is that the patients should be breathing in a normal manner. Yeah. How will you know that patient is now breathing in a normal manner? Shiny, how will you know?
By monitoring use chart, we can check frequently the respiratory rate.
Yeah, so again, going back to the same sentence that I told you earlier, that if you can use one tool to tell you what is wrong, you can use the same tool to tell that whether it is right now. Yeah. So you use the respiratory rate to tell you that patient is having shortness of breath. So now you can use the respiratory rate again to say that, okay, patient will be breathing normally and his respiratory rate will come to a normal range of under 20. Yeah. So that will be your evidence. If his respiratory rate comes down to below 20, you know that his breathing has got better, isn't it? Again, if the problem is pain, your aim is going to be that patient will be comfortable and his pain score or his pain will be better, as will be evidenced by his pain score of less than 3. So earlier, if his pain score was 6, you want to bring it down to less than 3. Yeah. Anxiety, if you have to say that, okay, patient will be much calmer and less anxious, as will be evidenced by the relaxed facial expression. Are you getting my point? So whatever is the problem, your aim is to resolve the problem. Whatever evidence you gave to show that that is a problem, you can use the same evidence to show that that problem is not a problem anymore, or that problem is reduced now, or it has got better. Yeah? Now, when we are doing the aim of anything should be smart. Now, with smart, what I mean is that S is for specific. M is for
measurable.
It should be measurable. Yes. A is for achievable. R is for
Realistic.
And T is for
Time bound.
So your aim should be smart, always a smart aim. So when we say that, okay, the patient's shortness with shortness of breath will get better, so you are going specific, you are talking about the shortness of breath. Yeah. Then you say that, okay, it is his breathing is going to, or his respiratory rate is going to get less, or from 24 it is going to come down to 20. So it is measurable, that you are able to measure it, that from what to what it is going to come. Yeah. It is reliable because you, or it is it is achievable. A is the thing. Next one, it is achievable because you can, from 24 to 20, it is achievable. So it is not that you are not going to be putting, and that answer our next thing as well. It is realistic as well. So it is not like that you are aiming for something which is unachievable or unrealistic. Yeah. And then you come to the time bound thing. So in the time bound thing, what you can add to it is that patient's respiratory rate, like patient will be breathing better and his respiratory rate is going to come down from 24 to 20 to below 20 in the next 4 hours. So you can add the time bound thing, that in the, your aim is that in the next 4 hours his breathing pattern should be normal and it should come in the normal range, and you have given a time bound thing as well. Same is with the pain, that you can say that patient's pain is going to get better, as will be evidenced by the pain score of less than 3 in the next 6 to 8 hours. Okay. Has everyone understood how to write the aim of the care and what to look out for that?
Yes, ma'am.
Okay. So now we come to the next thing, reevaluation date. If you look at the reevaluation date, so the reevaluation date and time, it is basically the reevaluation of your care plan. Please do not get confused with reassessment of the patient. Okay. It is not the reassessment of the patient. It is the reevaluation of your care plan. for example, you have said that, okay, patient's pain is going to get better. Yeah. You are saying that in about 8 hours, you are saying that the pain is going to get better. But in order for you to see, you probably will be reassessing the patient every maybe 4 hoursly. If the new score of the patient was something like 2 or 3, you will be reassessing the patient or monitoring the patient every hourly or maybe 4 hourly. But it does not mean that you are going to keep on changing your care plan every hourly or 4 hourly. Your care plan is going to be changed when you think that you have achieved your aim, or when you should have achieved your aim. So now in the reevaluation date, we have to think about this thing, that in the hospital, if you are writing a care plan for the in-hospital scenario, then anything in the hospital, you should have achieved that aim within the 24 hours. Yeah, because it is an acute problem that patient is going to come. So within 24 hours, you should have sorted out that thing. You cannot have shortness of breath for weeks. You cannot have pain for weeks. Yeah. You cannot have a patient suffering with the risk of infection, risk of deterioration for weeks. So that has to, if the patient is in the hospital, that thing has to get resolved within the 24 hours. So it will now depend that within 24 hours, how much time you are going to give for each problem to resolve. Now, shortness of breath, you do not want the patient to be in short of breath for 24 hours. Whether you are going to nebulize the patient, you are going to give oxygen, or whatever you are going to give to the patient, you maximum within 4 hours, patient should be better. Yeah. So you are going to put the aim in such that within 4 hours, the patient should be feeling much better with shortness of breath. 4 to 6 hours, or definitely within 8 hours, they should be feeling much better. If it is pain, for pain, you will wait at least to give 2 lots of painkillers. So for the pain to come down from the whatever pain score it is there. So probably you will be giving them about 8 hours for the pain. If it is anxiety, you can give it slightly more time, that, okay, patient will be less anxious in the next 12 hours or so, because whatever patient is anxious because of the shortness of breath. So once the shortness of breaths get better, patient's anxiety is also going to get relieved. Yeah, so you can give a little bit more time for the anxiety kind of a thing. If patient is constipated, again, you can give at least 12 hours for the constipation to get resolved. Yeah. So in anything which is there for in-hospital scenario, like if you are writing for news or GCS, if you are writing the care plan, make sure that whatever problem is there should get resolved within the first 24 hours. Okay. If you are writing or a reevaluation date for anything which is in the community, in community, the problems are like malnourishment is your problem, depression is your problem. Now, those are not going to get better in just 24 hours. So your reevaluation date should be in weeks or months. Okay, so majority of the time you can write a week's time, because you are going to come and see the patient in a week's time. Or sometime you can write a month as well. So depends upon scenario to scenario. Has everyone understood this basic principle?
Yes. Yes.
Yes.
Yeah. Okay. Any questions so far?
No.
Okay, great. So then we move on to the next sort of thing, that when we are writing the care plan, if you will see that there is a section where it says care by the nurse, and then there is a section of self-care. Okay. Now, what it means is, in the care by nurse, it is pretty straightforward that is the care what you are going to be giving as a nurse to the patient. For self-care, it is something that the patient is going to do. Yeah, because you alone cannot look after the patient. The patient will also need to help you out in achieving the aim. For example, if you are going to say that, okay, I am going to be monitoring the patient and checking his pain score on regular basis. Then in the self-care, you can say that patient is going to comply with it and tell me the pain score. If, for example, if you are saying that I'm going to be giving medication to the patient, you can say the patient will take the medication and let me know if there is any adverse effect. If you are going to say that I'm going to explain all the things to the patient and gain his consent, patient will understand everything and give consent. Are you getting this point? Are you understanding it? Agu, Bonnie, are you getting my point? What I'm trying to make?
What you're saying that for each care, we need to write the self-care as well.
It is not necessary that for each one that you will have to write, but you will have to write at least 3 or 4 self-care points as well. But do you understand that by self-care, what do I mean?
Yeah.
That how you can write the points?
Yes, ma'am.
Yeah? Okay. So basically, this is what a care plan is there. Then in the end, you will have to print your name, your signature and date. Now that is very, very important. And we tell everyone that as soon as you get this thing, before you write anything in your care plan, first of all, write your name, signature and date, because you do not want to forget that thing. Sometime, because when you are running out of the time, you do not have time to write your name and signature. And if you have not written that, then nothing is going to be marked. If you have written, then it is possible that, okay, if you might have written 1 or 2 less sentence, but at least it will get marked. Okay. So this is the most important thing, that you have to write your name, signature and date. Fine. Now moving ahead. If we see quickly, although I have already told you that what do we need to write in the care plan, it is the problem of the patient, current, ongoing or anticipated. It can be any. Is the patient post-operative? And are there any specific observations requirement? Now for post-operative and for the GCS, yeah, you have to be very specific with a couple of sentences that you have to write. And those are very specific that you do have to mention those things in your in the care plan. We will come to that in a while. You can also write normal abilities versus current capabilities of the patient. So by that, it means that the mobility issues, if you will see that problem with activities of daily living, it is possible that before patient was admitted to the hospital, they were able to mobilize themselves on their own, but now they are not able to. So it is normal ability versus current capabilities. Find out what is actually concerning your patient. Do you need to give your patient any information? And is there any family need to look after? So these are all the information that you can write in the care plan. Now, how will you be evaluated? Now, in the evaluation sort of thing, so basically, it is going to be evaluated by clear and legible handwriting is very important, because there is no point if they can't read anything what you have written. You have to write 2 relevant problems. Both of these problems should be separate. So you can't write as breathlessness and shortness of breath. You can't write these as problem because these are same. Okay, so the problem have to be distinctly different. So you will have to find 2 problems, 2 aims. You will have to set appropriate time for evaluation date, ensure the nursing interventions are current and related to evidence-based or best practices. Self-care opportunities are identified and relevant, and you use professional terminology, and you're not going to avoid, or you avoid all the abbreviations. So don't write anything in abbreviated form. If you want to strike anything, if you want to cut anything, then there has to be single cut with your initials on the top. And you will need to make sure that you print, sign and date. Your name, sign and date should be there. These are the most important things, how you are going to be evaluated. Now, how do you know that your care plan is good? That it is pretty straightforward, that it should fulfill all the criteria. and you should be able to finish it in 15 minutes. Now, I'm just going to quickly take you through one of the scenarios, yeah, to see that how a care plan will look like. Now, if we take this as a scenario, so it's a 56-year-old man who has been admitted in the male surgical ward for elective carpal tunnel surgery in his left hand. He has been nil by mouth in the preparation and having been allowed to take clear fluids up until 6 a.m. He has attended pre-assessment clinic and therefore it is prepared for the surgery. He is a diabetic, but only on the tablet controlled diabetes. He's also been treated for hypertension and suffers with high cholesterol in the last 5 years. His main carer is his wife, who suffers with MS or multiple sclerosis and is wheelchair bound. And their daughter is moving back home in 2 weeks, for 2 weeks to look after them while Raj is recovering from his surgery. Okay, so this is the assessment scenario. Now for this, you will need to write a care plan. So now the scenario update. So if it is for every thing, when you are going to go from assessment to care plan, they are going to give you an updated scenario for the care plan. So in assessment, as you know, that Raj was waiting to have the surgery. Now it is that Raj is now post-operative. You have just collected him from the theaters and brought him back from the wards. He remains a little drowsy as he was given morphine in the recovery. He was because of the pain. And based on his updated information and your pre-op assessment, please now write a post-operative care plan for Raj with at least 2 problems relevant for the next 24 hours and ensure that you complete all sections of the care plan. Everyone has understood what is the update? Okay. So now the first thing is going to come, how do we choose a problem? Yeah. So his presenting problem, as we know, was carpal tunnel surgery. He was probably suffering with pain and probably he was anxious as well. With the history, you can see that he is looking after his wife. His wife suffers with multiple sclerosis and wheelchair bound, and he is going to have the surgery. So probably he's very anxious that how am I going to look after her? Because his hand is going to be, he's not going to be able to use his hand for some time to help her to move around. Yeah. So these are some of the problems which were a presenting problem. But now he has had a surgery. So currently the problems can become risk of aspiration. As we have already told you that he is still very drowsy under the effect of morphine. So there is always a risk of aspiration. Self-care deficit. Self-care deficit could be because now he is not able to use one of his hands. So he probably might not be able to do all his activity of daily living himself, and he will suffer with self-care deficit. And there is always a risk of post-operative complications such as infection in the wound or some bleeding or something of that sort. So we have lots of problems that are there, and we have to choose 2 problems out of them. Everyone understood that?
Yes, yes, ma'am.
Okay, so since the patient is post-operative, the most relevant problem at the moment is going to be that Raj's risk of aspiration related to anesthetic as evidenced by the post-operative drowsiness. Now again, in this one, what is the problem? That he's at risk of aspiration. How did you find out about that? Or what is the evidence? Because of the post-operative drowsiness. Okay, so we have got this as one of the problems. So we are going to write what should be our aim. So our aim, we know that it should be SMART. So it is going to be that Raj will safely recover from the anesthetic and be fully alert and oriented in the next 4 hours. So he will safely recover. So the problem was that he is at risk of aspiration. So we are saying that he will safely recover. Earlier, we knew that he was at risk of aspiration because of his drowsiness. So now we can use the same state that he is now going to be fully alert. That is going to tell us that he is fully recovered. When he is alert, obviously, then he is not going to be at risk of aspiration. And we give him around 4 hours to do that. So it is a time-bound sort of thing. Everyone with me on this one?
Yes, ma'am.
Okay. So now reevaluation. So we are going to say that, okay, our problem, because our problem was of drowsiness or risk of aspiration, we do not want him to be at risk of aspiration for very long. So we are giving him 4 hours to be reevaluated, that within 4 hours, his risk of aspiration should go away. Yeah. So I will reevaluate that care plan in 4 hours time, because that is the time when I am thinking that I should be able to achieve my aim. Got it? Now this is an important slide. So we have already discussed that how to choose a problem, how to write an aim, how to do the reevaluation time. And then we looked that there are nursing intervention and there are self-care sort of things. So we know those things. Now, in order for you to help with the nursing intervention and self-care, this is a mnemonic that we normally use, which can help you how to formulate your nursing interventions and what to write in the care plan. Yeah. I'll share a picture of this slide. So don't worry, you don't have to write this down. I'll share a picture of this slide. Yeah. And then you can see and you can use this slide to write the care plans. Now, in the first one, so the mnemonic for the nursing intervention is imatarid. Yeah. Now, in the imatarid, you'll see that first thing is explain. E is for explain. So basically what you are going to do is that I'm going to be explaining all of the nursing intervention to the patient and gain his consent. Yeah. And in the self-care, you can see care is a mnemonic for that one. So I have asked for consent, patient is going to give consent. Then the second thing is monitor, that I will be monitoring the patient's, say for example, in this one, drowsy, if you are saying the drowsiness, I will be monitoring patient's state of alertness on a regular basis. For this one, because patient is drowsy, I'm not expecting that patient is going to tell me anything over here. Then you are going to do assessment, that you are going to be doing assessment or of the patient's vital signs. So you are going to be taking his regular temperature, blood pressure, and all those things. So you are going to be doing his assessment for all those things. Then for T is for teaching. Again, teaching might not come in each and every sort of thing. Over here, it is might not be that relevant, but still you can say that you are going to be teaching or the patient to sit in or to stay in an upright position. Because if they are in the upright position, less risk of aspiration. Then administer is, you are going to be administering his medication and patient is going to take the medication. Now, if you see on the other side, alarm and ask and report and all that, you can say that patient is going to raise alarm if he is having any shortness of breath or something, or if he is not able to breathe, or if he is having any coughing fit or something like that. Then administer, you have administered the medication, patient is going to report if there is any side effect of that medication. R is for refer. Now again, refer might not be something which is relevant for each and every situation, but say for example, if the patient is, if you are doing a must scenario, in that definitely you are going to refer the patient to the dietitian. If it is a patient who has had a knee replacement or a hip replacement, or even in this one, carpal tunnel one, that we are going to refer him for physiotherapy, because we know that the patient will require some physiotherapy. Yeah. Then come instruct, that you are going to instruct the patient to take care of the wound and make sure that it does not get infected. And then D is for documenting, that you are going to make sure that you document all the findings in the patient's notes and update his notes. Have you understood that? Do you think that you can write a care plan using all these things? Anything in this which is confusing or which is not clear? Okay, so let's move on to the next slide. So in the nursing intervention, if you will see, as we had given the example, so for E, we are going to make sure that, so E was for, what was E for? So explain. So we have said that ensure Raj is nursed in a suitable recovery position with his left arm elevated with pillows. So in a Bradford sling. So actually we can use E for, over here we have used E for ensure, but we can use this for explain as well, to explain and gain his consent. Okay. Then this one, the next sentence, which I have made bold, this is a very important sentence, and this is something that you will need to write in any post-operative care plan. Yeah. So that when we are monitoring his vital signs, we are going to monitor vital signs as per post-operative regime, every 30 minutes for 2 hours, hourly for 4 hours. And then depending upon the news chart, you are going to escalate the concerns. So these are the post-operative observation that we will be doing post-operative observation every 30 minutes for 2 hours and then hourly for 4 hours. Okay. Then as we know that Raj is diabetic, then we are going to assess his blood sugar levels every 30 minutes for 2 hours and then hourly, because that is also a part of the monitoring of the vital signs. Then we will teach Raj how to use the call bell system and ensure that it is in place with easy reach of the patients of his right hand. Administer all IV fluids as per prescription, or IV fluids or his medication as per prescription, and then maintain a fluid balance chart. Monitor all his verbal, non-verbal signs such as restlessness, moaning, agitation, all those things, and refer him to the pain team if required. We will also refer him for the physiotherapy. Instruct Raj that he needs to maintain his nil by mouth status, still fully awake, because we don't want him drinking something and hence aspirating. And then we are going to document the warmth, color, sensation, movements of Raj finger on the left hand and other sort of interventions that what we have done. So this is just an example. You don't have to like fully copy this thing. You have to think of what your interventions are going to be and you have to document accordingly. But you can use this mnemonic imaterate to help you write or give you an idea that, okay, give a structure that how you are going to be writing the care plan. Okay, so any question in that slide or anything, any questions till now? We have just got last couple of slides left. So, okay, then you need to think, sorry, was anyone asking anything? Okay, if no, then we'll move ahead. So you need to think about the self-care bit, that is there anything you need the patient to report or contribute? So the self-care when you are doing, then you can think about that, whether you want Raj to tell you something. Is there any nursing intervention that patient could take on, like maintain their own fluid chart or something like that? Or at least tell you that whenever they are drinking something or whenever they had a glass of water, they can at least tell you that they had at that time. And also, what do you want them to be able to do by discharge? That they should be able to administer, if they are on insulin, they should be able to administer insulin. If they are on a stoma sort of bag, then they should be able to change that. If they should be able to do their blood glucose, they should be able to do their peak flows, all that kind of things. And they should have an understanding of having a low fat meal diet and all that sort of thing, depending upon what scenario it is. Okay. Then the top tips are just to read and understand the scenario update, keep it simple. This is very, very important to make sure that you keep it simple. Don't overcomplicate the things. Just make sure that it is a simple exam, simple things that you have to write, simple interventions that you have to write in that one. Make sure your handwriting is clear and legible. Ensure that if you are striking out anything, that you retain the legibility, that it should be just one single thing rather than making cross on that, just a single thing, and you initial on top of that. Focus on your goal and think of smart aim. Remember that it is one care plan with 2 problems. You do not need to repeat any interventions. Like if you have taken consent in the first problem, you don't need to take the consent again. If you have documented in the first one, you don't have to document again in that one, because it is one care plan that you are writing. If you are assessing, make sure that you use the tools. That if you have tools, like if you have the pain scale, you have the MUST tool, you have the PHQ-9 tool, you know your news chart, you have your GCS charts, use these tools when you are saying that what you are going to be doing, because they will form the objective criteria and they will give a depth to your care plan. Yeah. And last but not the least, remember to sign and date. Okay, so that completes our care plan sort of thing, what I had to tell you about the care plan. Do you have any questions? Okay, if you guys don't have any questions, that is no problem at all. So what I'm going to do is that I will be sharing with you some must scenarios today that you will need to practice on. And I'll also share a couple of care planning scenarios. So I want you guys to write one care plan at least today, and see that how you can, whether you are able to write it and what are the problems that you are facing on it. Yeah. So tomorrow, when we are going to be discussing, I think that the first thing that we will start is that maybe I'll ask a couple of you to read out your care plans. Okay. And it will not be a bad idea that whoever have written the care plan, that if you can just share with me on the, you can send it to me on my WhatsApp, individual sort of WhatsApp rather than the group. You can send it to me and then I can just go through them and have a look and give you some feedback on that one.
Okay, ma'am.
Okay. I would definitely expect the care plans from the people who are appearing for the face-to-face training. But other people who are going to come in the next batch, it would be a good idea for them to practice this as well.
Do you have any more examples of the care plans, only or just this one?
See, example I have enough, but example is usually just one. Okay. I have lots of examples, but there is no point. Example usually is always one. Yeah, this is just to show you. But idea is that you should be able to, with the scenario, you should be able to write the care plan yourself. But probably what I'll do is that I will give you a list of what are the very common sort of problems which keep on coming in the exam. Okay. So if you can practice writing the care plan at least for those 8-9 problems, then you know that in the exam you would cover these will be the problems. So you don't have to write like hundreds of care plans. If you are able to write care plan just for those 4-5 things, you in the exam you will just have to make sure that you adapt it according to that scenario which you get in the exam.
Okay, that's what I mean. We will get some ideas, isn't it? Yeah.
Yes, you will.
Okay. Hi, ma'am. I have a doubt, about the interventions.
Yeah.
In the care plan itself, only 5 to 6 interventions, or the single problem must have 5 to 6 interventions?
So every problem should have 5 to 6 intervention. So both of your problem, if you are going to see, you will require these, or you can use the imatinib for both the problems. Now, I know that I have said that you should not repeat the thing, but like for E, you can have explain and you can have ensure as the thing. For monitor, in first you can monitor the maybe your vitals. In the second one, you can monitor the blood sugar or something of that, or you can monitor the constipation, or you can monitor something else, whatever the problem is.
Okay.
Yeah.
Okay, ma'am. And ma'am, the medications which you have sent last day, what all things we need to study from that medication slip?
That also I have written in that thing. If you will see at the bottom of that chart, I have written that what all you should know in these medicines. Yeah. So in the medication, basically what I want you guys to know is that what is the, which family that medicine belong to.
Indication.
Yeah. What are the indications? What are the actions? So there is a list that what is the group of that medication? What is the indication? Why do you give that medicine? What is the dose? By dose, I mean what there are certain things they have a fixed dose kind of thing, but certain things they have a probable, they come in different strengths, and depending upon what is the intensity or what is the problem. Like say for blood pressure medication, you can have atenolol coming in 5 milligram, 10 milligram, 2.5 as well, depending upon how bad the blood pressure is, you can give that. So you need to know what are the different strengths which are available. Then you need to know the frequency of the medication, side effects, and the nursing responsibilities. So these are all the things which you will actually be checking in when you are doing your implementation. So you need to know the right medication, right dose, right route, right frequency, and you need to know the right nursing intervention and right documentation. So these things are the 5 R's that you need to know. So with the side effects and things, you don't need to by heart all of the 100 side effects which are there. Just 1 or 2 common side effects which are there for that particular medication should be more than enough.
Ma'am, let me ask you one thing. What is this MG123? Is it the medication?
This is the medication group. So for some time we make group of people, and they, like say for example, if you are 20 of you, then I can make 5 groups of 5 people, and each group will be given 5 medication, and then every group is going to tell me about those medications. So that was just for it. So ignore the MG, just do the others. Okay.
Yeah, ma'am, 1 second. Regarding the drug formulary, how to access to that BNF?
See, I think that that is best if you have a laptop or a computer. On the phone, it might be difficult to sort of thing. But if you have a laptop, then if you are go on the Finder. So I think it is Command F. If you press, then you will get a Finder on top of that. And if you want to find any medication, you just write that medication over there, and it is going to take you to that page where that medication is. Now, when it takes you to that page, that it is possible that it is going to take you to all of those pages where that medication have been mentioned. Yeah, but it is also going to highlight that place where it is the mainly given, that medication. Okay.
I think this BNF is available in Google as well, isn't it?
Yeah, it will probably be available in Google as well. Any more questions, guys? Okay, fine then. So I'll see you guys then tomorrow. And I'm going to be sharing all these things. I'll also share a implementation chart, which we are going to be discussing tomorrow. Okay, so just have a go through it. You don't have to by heart or read anything as such, but just go through that one. Okay. Okay, fine then. Thank you very much, all of you. And I'll see you all tomorrow.
Thank you.
Okay, take care then.